feedback from somebody on the phone, so I muted everybody. I just wanted you to know.
So Lisa, that's why I was talking and yeah, I was muted. Okay.
Sorry about that, Kelly.
Welcome.
I'm sorry.
That's okay. No, I use my phone too. So if you're using your phone, you have to unmute a different way too. So welcome everyone. We're super excited to chat with you today a little bit and to really get going on this second round of testing. So thanks for joining us. Let's see. I am going to ask Lisa, Beth, Heidi, Kelly Miller to say hello and introduce themselves before we jump right in.
Hi, I'm Lisa Allersmeyer, supporting Superintendent Region 3 and 4.
Hi, I'm Beth Chambers, representing Superintendent Regions 1 and 2.
Hi there, I'm Heidi Davidson. I support Regions 5 and 6.
Good to see everybody.
It is. And Richard, if you cannot hear on your computer, maybe you can watch on your computer, but also use your phone to call in and listen on your phone. And that should work for you.
Okay, thanks, ladies. Has Kelly joined us? I can't see the participants right now. While you're checking on that, I guess I should introduce myself. My name is Kelly Fehrenbach, also with department in OSAS, and we are really excited to see you all. So is Kelly on? Maybe not yet.
I don't think she is yet.
No.
Nope.
Okay. All right. I don't think any of us would want her schedule at this point. All right. So without further ado, we're going to go ahead and get started. First of all, we would love to hear from you. I think we have quite a few people on this call. So if you want to say hello in the chat, we would love to hear from you. That'll also help us keep track of who joined us today. I am also going to ask that you please do mute yourself so we can minimize, all of the interruptions. Either mute yourself on your phone or on your computer, either one, please, or both. Okay, so just a couple of other housekeeping things. We are recording. You should have heard that announcement a little bit ago. So if there are folks that couldn't join us today, they'll be able to watch this and get the information they need later. So once again, welcome. We have a few things, some really important big things to cover today, but just generally speaking, we're going to talk a little bit about expectations. We're going to share some tips as you get started with testing. We're going to walk through the electronic form that we'll be using just for testing. We're going to talk about the survey that you'll be using to share your feedback on the assessment and IFP. And then we'll wrap up and we'll take any questions that you have. So let's go ahead and get started then. So I believe Lisa, Heidi, and Beth are going to take care of the chat. If they have any questions, they're going to jump in and share those. As I said, I can't see the chat right now. But also they're going to jump in just in case I forget anything really important to share with you all. And then we're going to have Heather Stubbs talk here in just a moment, so I'll have her introduce herself when we get to that portion. So, all right. So expectations. This hasn't changed a whole lot. Way back when, early this year, we talked about agencies in 6 different regions. That's the same as it was. Still looking at each agency having 2 testers. And then those testers looking at testing with 2 different teams. So one thing that I just wanted to note here, this came up in our last meeting. When you test this full assessment in ISP, it is absolutely okay if you are looking to test with new folks, not the folks that you tested the assessment with earlier this year. So that question did come up. Just wanted to make sure to call out that that is absolutely fine. 2 new teams is great. We do still want you to consider a variety of needs, though, when we think about folks with pretty intense health needs, behavioral needs, et cetera, right? And also think about different ages as well. We really want to make this a very thorough test and make sure that this works well for folks of all different kinds of abilities and age ranges. The other thing that I did just want to bring up really quickly, and I'm guessing you're all aware of it at this point, but I don't want to go without saying it, is when we met, it's been about a month ago, the folks that were on that call did opt to do a full test. So we threw out the option of, do you just want to test the ISP portion or do you want to test both? And overwhelmingly, people said, we want to test the updated assessment with the ISP. So that is what we're doing. So you should have already received the materials from us. So just a few things to get you started, and then you're going to receive some materials from us after this webinar as well. So once you receive those materials, you can begin testing whenever it works out well for you and the teams that you'll be working with. Please be sure to include the team members that the person agrees upon, right? Everyone that should be involved and the person is good with being involved, please include them in this process as well. We are asking that you conclude your testing by 10/12. So if you could have everything finished up by then, as well as completing any surveys, that will help us to keep moving. So just a reminder about who is testing. As you can see, we have a pretty wide variety of agencies from around the state, large and small, and who they serve. So again, just really trying to get at a really robust test so that we can ensure that this is going to work for a wide variety of folks. So the next thing I wanted to share with you, you would have received this in your email yesterday when we sent out an email. And this is just a letter that we would like for you to share with any folks that will be participating in the testing. So any team members, the person, perhaps you could go over it with them, their family, whomever is going to be participating in this process, we'd like for you to give them this information. We definitely want people to understand what they are a part of, and also give them an opportunity to not only provide feedback, but to know where to go if they want to see about progress, if they want to learn more and know more. So please do share that with folks. We wanted to just take a moment to share a little bit about what we learned from the last time we tested. So when we tested assessment questions early this year, you all did such a wonderful job, and I know you worked so very hard, and we got some really thorough feedback. We were able to make a lot of updates to our questions. We reduced a lot of questions where you said we had duplication, a lot of situations where you said, hey, if I'm talking to a kiddo, this might not necessarily apply. So we learned a lot from that. Excuse me. We learned a lot from that information, so thank you again. But a couple of things that we also just wanted to call out is that we really want you to talk to folks and think about the folks that you are going to be working with and discuss how many times you want to meet. So overwhelmingly, folks only met one time. And we did get a lot of feedback that assessment took too long. So granted, we did ask you to ask every single question, so I'm sure that made it take long. But we'd also like for you to consider, if you're working with someone that really only has an hour and a half in them at a time, please only meet for an hour and a half. We did see a lot of feedback about people were tired. They wanted to be done. We certainly don't want you to put you in a position where you feel like you have to make people uncomfortable to get this done. So please do try to be flexible and talk to people about how many times, how much time, and so on. The other thing I wanted to call out on this slide is how many hours did it take to complete. So we had a pretty wide range of responses to this. We had 4 folks say it took an hour. And then we had, quite a few say it took more than 10 hours. So on this survey that we're going to ask you to complete, we're being a little more specific. When we ask you for how many hours did it take, we're going to give you a little bit more guidance on what you should include. But we really would like for you to think about how long is this taking me to do, from starting the assessment into planning. So just a couple of things I wanted to call out quickly. One more thing. We also got some feedback because we did ask about where did you meet, and some folks use the phone, which is awesome, right? And especially now, we know you're going to have to get creative with how you meet with people. I'm sure some of you are going to use Zoom or FaceTime or whatever. But again, please do be aware of the amount of time. A 4-hour phone call, obviously, not a great time. And we certainly, again, don't want to inconvenience people too much. So just being aware of that. All right, so you have another document. It's a one-pager. And you may remember from the last time that we tested, we said right out front, we don't want to give folks a lot of training. We're not going to give you a lot of training because we want to see what happens when you just pick it up and you try it. So this is not going to be any different. The training you're going to get today is really these high-level tips, and you're going to get instructions on how to use the electronic form. But beyond that, we really want to just see how it goes if someone just picks it up. But we want to make sure that we're at least on the same page when we approach assessment and planning. So the one-pager is really that, hey, let's all try to approach this in a similar way, even though we've had minimal training. So I'm not going to read each of these because you've already seen this assessment one-pager, but I do want to call out just a few because we're testing this whole process. So remember, an assessment, this assessment is about a conversation, a dialogue. So all of the questions in the assessment are meant to be conversation starters. And I also want to remind you that it's not supposed to be rigid. It should be flexible. You all have been talking to folks for a really long time, so I'm certain that you are more than capable of, hey, if it didn't work worded that way, maybe I should try it a different way. And that's okay. It was actually designed that way so that people can say things in the way they need to based on the person they're talking to. So also want to just say assessment and discovery drives planning. This is the last row on this slide. I think this is a really important part. Lately, we've talked a lot internally about how sometimes all the work happens in assessment and sometimes all the work happens in planning. And we're really trying to get to that place where it's very clear what happens in assessment and what happens in planning and how do we get from one to the other. So assessment and having those rich conversations, it really should drive planning, which is where you then say, hey, based on all those needs and abilities that we learned in assessment, now let's talk about how do we develop supports and identify services. So hopefully that makes sense. If you have any questions about that, feel free to put something in the chat. But we want to be clear that assessment is where you discover what someone wants, what someone needs. planning is where you start to identify what supports look like and what services someone will receive. So I think that's a good segue to the next slide, which is really about assessment-informed planning. So spending just a moment on this one as well, planning is an ongoing conversation. Planning is a conversation that's a result of the work that you've done in assessment. And if you've done a really great job and had really good conversations in assessment, then planning typically goes a little easier. The other thing we want to call out is that plans should change when life changes. Gone are the days where planning is a one-time annual event, or someone tells us something new and we're like, yeah, you've got a meeting coming up in about 3 months, so we'll do it then. It really should be, as life changes, plans are updated. Full team involvement with the person at the center. So this is really about planning and using the team process, making sure that a team is communicating, sharing what's working, what's not working. I know SSAs and Qs are responsible for a whole lot, but it is not entirely on their shoulders to develop a plan that works. A team has to do that together. Excuse me. A plan also should creatively address support in a variety of ways. So certainly thinking about technology. How can we use technology to support someone in a way that allows them to have more control over their life? How can we look at local and community resources so that folks can learn things the same way that you and I do? Maybe they don't need a paid service for that. I know I use YouTube a lot, so I'm not sure if you do, but I certainly do. A little bit more about what planning is. So planning is about the authorization of services and supports based on what you said in assessment, right? So there should be a clear link from what you learned in assessment into planning. Here's what we're authorizing. But we don't want, what planning isn't, is just authorizing services and supports based on what's available to someone or what's previously been provided, right? We don't want to just assume services right away. And then finally, a living document to ensure people have the opportunity to live a life that's meaningful to them. That's really what we're all shooting for, right? It's how do we bring person-centered planning to life so that it truly is a living, breathing document that is carried out in a way that supports someone to have the life that they want. So that is assessment informing planning. And I don't know, Lisa, Heidi, Beth, if there were any questions before I start talking about this form and what it is.
No questions.
All right. I'm either being super thorough or super boring. I'm not sure which, but I'm going to shoot for
Or maybe
thorough at this
folks are
point.
going to save them for the end.
True.
Oh, there's a question.
Oh,
There's
now
a
we're coming
question,
in.
Kelly. You called one
Sure.
out. So Kyle asks, does this indicate that each assessment area will be separate from the plan area it corresponds with when the finished product is complete?
So that is that is an interesting question. Right now in document form, we have combined them into one document, if you will, but it really is kind of an assessment that drives a plan. They do feel a little more separate. What's going to happen in the long run, and you're actually going to see some of this with the form that Heather has developed for us. What we're shooting for is an assessment that feeds the ISP. So they might, right now in a manual way, they're going to feel separate. In an electronic form, they really are one. Each assessment section will feed different areas of the ISP. So I hope that kind of answers your question, Kyle. I think you'll see that a little bit more as we go through this. And if it didn't answer his question, then probably people aren't going to ask questions anymore, right? That is not what I want, by the way. So Kyle, please do let me know if you want more information or if I didn't understand correctly. So before we jump into this form, and if there are more questions that come in, please don't hesitate to speak up. But I just wanted to say a few things because Kyle's question is a great one. One of the things that we've struggled with is how do we test a Word document without getting bogged down in this is a Word document. It's clunky. It's not super easy to use. It's not intuitive. And so you may recall that when we tested assessment earlier this year, we had Heather Stubbs from DODD's IT group. She developed this fancy little electronic form that we used to input that information. So just a couple of things I want to say about that really quickly. First off, I'm really excited that Heather has been able to do some really great improvements to this form so that it can be a little bit easier for you. But the other thing that I want to say is that, we have 2 Word documents that we combined into one. You should have received that yesterday in your packet, so you can feel free to look at that. But it looks one way, right, because it's a Word document. And now what you're going to see from Heather is going to look a different way because it's an electronic form. And then eventually we're going to have this IT solution that's going to look somewhat different. So I just want to make sure that folks realize that, the reason we're using this form is because it's going to make it a little bit easier to test. It also gets us a little bit closer to the kind of functionality that we're looking at in an IT solution. So I just don't want people to think, wow, this looks so different, or think that this electronic form is the IT solution, because that's not it either. This is just a tool that we're using to make it a little bit easier for folks. So I've probably said enough. Heather, I want to welcome you and ask you to introduce yourself, and I probably should stop screen sharing so you can take it from me.
Thanks, Kelly. I'm Heather Stubbs. I'm with DODD, the IT training supervisor. So I'm going to share my screen so you guys can see the form. So hopefully everybody can see my screen. What I'm going to do is I've got an uncompleted form here, but I'm going to actually demo and show you one that I've started to fill out, just so I can point out some of the items. Hopefully everybody can hear me and see my screen with no problems.
Sounds great, Heather, and we can see it.
Perfect. So a couple things before I get started. Again, this form is just to be used for testing. This is not what the final system is going to operate and look and feel. Because this is a web page, if you want to make your screen bigger, you hit Control+. Makes everything larger. If you want it to be smaller, Control-. So I'm going to make it a little bigger so everybody can see it more easily. If you want to print this, Control-P. We'll go through that a little further down because there's a couple things I want to show you. Besides some of the changes to this form, there have been some really cool features that Form.io has updated. Typically, the last time when you did it, if you were filling out an area, you would have to either scroll or take and drag and drop the little corner. Well, now this has changed and it will auto expand for you. So we've got the initial information. We've got, you'll need to put in your email. The reason is because you're going to be able to go back and view your submissions and modify and add to them. So that's where you see this little view and edit and your submissions. And I'll go through that a little further down after I've shown you the form. So we're going to go ahead and get started. So we've got this light blue bar that signifies the assessment area. So this is all one page, the assessment and the ISP. So the lighter blue is the assessment area. Again, like the last testing, anywhere you see add another, you see a little plus button. That's where you're going to be able to add additional rows. Try to move this further. And you'll have the little X so you can delete them. We still have the questions. We still have the little tooltips that you're used to from the last testing. They will be on the question mark as well as in the box. So you'll see them here to help help you along the way, but as soon as you start typing, they will go away. All right. So we'll go through, we've got the communication chart. So for the assessment, you had the important twos, important fours, skills, abilities, and risks at the bottom of the assessment, all of them combined together. What we've done is we've put them in each area. So now you're going to see communication summary, important twos, fours, skills, abilities, risks. One of the nice things with this new form is I'm putting information in here in the assessment. I'm going to show you further down in the ISP that auto generates into those fields down in the ISP. Let's keep scrolling. And I don't want to spend too much time scrolling through everything. You'll also have, we've got the safety and security area. So I want to talk about well, Kelly is going to talk about this little area, the supervision considerations. So
Sure.
Kelly, talk about that.
Yeah, can you hear me okay?
Oh,
okay, I had to unmute myself again.
Okay, yep.
There we go.
We're good now. All right. Yeah, so supervision considerations. Hopefully when you go through this assessment, you'll see some of those updates based on feedback. This is one area that just wanted to call out because it is different than what you tested previously. So our external work groups spent a whole lot of time talking about levels of supervision and levels of support, and really what should supervision look like in this new assessment and plan. And one thing that we kept going back to is, hey, figuring out what levels of supervision looks like starts not in planning, but in assessment. And then we said, gosh, it starts even before that, right? It starts with those pre-assessments where whatever you're using, level of care, OED, COED, any other pre-assessment you might be using, we learn a lot in those pre-assessments about level of supervision and other information as well. So we're just asking you here to consider the results of any pre-assessments related to supervision. So this is an SSA QIDP only question. That's not a question you're going to ask the other folks that you're spending time with. So thanks, Heather.
You're welcome, Kelly. All right, so we're going to keep going down. And I'll show you, when I talked about the fields expanding automatically, I'll show you what that means. So you're typing. You no longer have to drag and drop this corner or have a scroll bar. The fields will automatically get larger depending on the amount of data you put in there, and then get smaller. All right, so we're going to keep going down through the assessment. So now we're getting into the plan. So we've got the bars are a little bit of a darker blue, and we've also got this little indication that this is the individual service plan. So we've got the individual's name. So we're going to just say Grayson S. We've got last name. This field is grayed out because we don't want you to include any confidential information, and you'll see further down where social, DOD, Medicaid number are the same. So for this testing, we want to leave that the way it is. So, but you can see how the form should look with what the information is. All right, so we've got the ISP cover page. On this test form, you're going to be able to either use your camera. If you're using a computer or a phone that has a camera attached, you can take a picture, or you can upload a picture. So let's upload a picture. You've got it there. So when you print this, the picture will appear on the printed version as well. And just like the assessment, when you tested the assessment, in each of the ISP areas, you're going to see a button to select if there were issues in the ISP area and put that information. It's just in the ISP area, not the assessment area. And you should only include if there are issues with the questions, not the form itself, because again, this form is just to help you test the information that you're including. So you'll want to make sure that you put in, if there is something, a suggestion or a problem, you'll want to check that box and put the information in. So now we've got the discovery summary. Up in the assessment, I had in the important twos and important fours information that has auto-generated down here. But the great thing is in the ISP, you're going to be able to add to that information. So the assessment, you've got just some important twos for communication, but now you want to add additional important two. You can do that here in this in these fields. So the important twos, important fours. Also for skills and abilities. You've got a new field here, the best way to connect with a person under skills and abilities. That's in the ISP. All of these fields auto-generated from the assessment. Now you've got the known and likely risks. So this is set up a little bit differently because you might have multiple risks in that area. So in the communication section, it pulled down what you had for known and likely risks. Then you'll fill out the information the support must look like. Does it require supervision? If you say yes, you're going to get a drop down field to choose. If you say no, there is no drop down. And then is also who is responsible. You're going to go in, and if you want to add additional risks in the communication area, you can do that. You can add as many as you need. You'll fill out the same additional questions. Supervision might be different for this one. And you'll have that option. So for each of the areas.
Hey, Heather,
yes.
I just wanted to call out for folks real quick. Those standard definitions, hopefully you saw them, but those standard definitions are at the top of the risk section, so you can see what you're selecting in your drop down. You can see what each of those means, but really the focus here, as we all know, is what support must look like, why the person needs that support. That's where you get into that really great detail about how to support a risk. So thanks for letting me interrupt real quick.
You're fine. Interrupt anytime. All right, I'm making sure I'm not missing anything on my notes. We're going to keep going down further here. Got the provider backup plan, working, not working. Solution for what's not working is in the ISP. So outcomes and experiences. I want to go through this a little bit, and because it's going to be different. So all of the counties, you might, the language might be a little different than what your county is used to. It might be a little different for everybody. So we're going to go through. For this testing, you will have to manually input previous outcomes. Now, I'm sure the new system will auto-generate and pull that information in for you, but for this testing, you'll just need to put it in yourself. So I'm going to put outcome 1. I'm going to go ahead and add in a second outcome. Now we get into new outcomes. So that was the previous year in progress on an outcome. Now we're going to do a new outcome. So if you'll notice, this interior box is a little bit shaded background. The reason is all of this information that's in this shaded area is tied to that new outcome that you are creating. You'll have below that, you'll have a box to add another outcome. So you can have as many outcomes as you want on the plan. But this box is all tied to this one outcome. So I am really dying to go back to the beach. So that's what we've got for my outcome. So experiences, in order to accomplish the outcome, what experiences does the person need to have? The nice thing about this is set up a little bit differently. What needs to happen, how it should happen. There might be multiple people that are responsible for that. So for what needs to happen, how it should happen, we've got that field. Add a second one. You could add a third one, as many as you need. You can delete it. Now I want to add another area into experiences. Same thing with who's responsible, when, and how often. So you can keep adding additional ones to get all of the information that you need to have for this outcome. Then we've got the review. Progress will look like, who and when to check in. Again, you can put in multiple fields to hit the information that you would like. These fields will expand. Depending on how much information you put in them. Then we've got the important and relevant history. So I know outcome area is a little different for some users. Before I go on to the next area, does anybody have questions about the outcome? The language, the way it looks, anything that you want me to touch on a little bit more? All right, I will move forward then. So now we've got.
Hey, Heather.
Yes.
Somebody asked if the session recording will be shared, and Kelly Fehrenbach, I believe it will. Can you confirm that?
I can confirm that it will.
Thank you.
Perfect.
I think we have another one. Sorry. Is there a place to put dates? Joe is asking.
For the outcome, there is not a place for dates. There is a place in the services and supports area here for dates.
Okay.
Kelly, that's something that you guys want to talk about. It can be easily added if it's something that's needed.
Mm-hmm. So at this point, because someone's saying, then he's saying stand dates for outcomes. So no, actually, our external work group did not identify that they wanted to associate stand dates with outcomes. So at this time, there are no dates associated with outcomes. So if you find that to be problematic, certainly, Joe, please do share that feedback when you complete surveys. Renee is also asking, in this form, are you not caring if it is not a complete sentence? So, Renee, I think that we would like for you to complete it like you would any assessment and plan, so that you can have that full experience on how well it works. And I would assume that you'll be sharing it with others, so you probably will want to, use complete sentences as much as possible. I think for Heather's demo, she's just trying to save us some time, so she's just typing in something to show us how each field works. So
Yes.
we have one more question from Ruth. Heather, can you scroll to show the entire outcome area again, please?
I guess I should unmute myself. Let me make my screen a little smaller, if that helps. Let me get rid of a couple of these lines. Okay, there we go. There's also The previous outcome area up here. This outcome area with the gray background is for any new outcomes. Okay. Does that cover
So
it?
we have,
Oh.
I think so. Sorry, Heather, we just had a couple more that came in. Well, outcomes that are measurable in task analysis work for the outcomes section. So, so I think, Melissa, some of what you are getting to is we've identified that outcomes, we have to do a better job with training and standardizing what an outcome is, how to identify, how we're going to measure, how we're going to know if progress is happening. We are not there yet with a template because we recognize that the template will only get us so far. So we did include some prompts in the template that we think will help us get there, and we're going to get the rest of the way through training and, quite honestly, rule updates. And obviously people following a standardized process. So I know that doesn't completely answer the question now, but outcomes, it's so much bigger than just a template at this point. We have more work to do there. The other thing that I wanted to just say, Richard asked about action steps. So Richard, our work group decided that action steps, people struggle with that and figuring out what to identify as action steps. And so our group overwhelmingly agreed that it's really about experiences. So in your brain, you can sub for a little while action steps for experiences. But when we talk about DSP is really knowing and what to do, how to provide services to someone, we really felt strongly that experiences, when you say to someone, okay, what experiences does Heather need to prepare her to go on vacation, that's a whole lot different than saying what action steps to prepare Heather for vacation. So that's the experiences piece. Sorry, we got quite a few more coming in. Heather, do you want me to keep rolling or
keep rolling?
Okay,
keep rolling. I
all
will
right.
mute myself.
Details to know and important history. So details to know, they're below the outcome statement. This is really about providing more detail about why this matters to the person, what they're working towards. So when we think about outcomes, one thing that many of us already know is if that outcome isn't actually important to the person, or if it doesn't make sense to them, they're probably not going to work very hard on it. It might actually work against us occasionally because they're not interested. So the detail to know is really about what about this thing matters to this person, and what are they really shooting for? That's what that is. The important and relevant history, this is history that might impact that person's life supports and achievement of outcomes. So maybe Heather went on a trip a couple of years ago and she was naughty, right? I'm totally making that up. I'm sorry, Heather. And please don't put in someone's plan that they were naughty. That probably wasn't a great example. But point is, maybe Heather did something on a trip a couple years ago that we want people to be aware of, because it could very likely happen again. Perhaps it goes there, right? But again, that's why we say, remember to only include history that impacts the person's life supports and achievements. If Heather, when she was on spring break for college, made some maybe not so great decisions on vacation, let's please not have that follow her now. So hopefully that's clear. This is where we're going to have to use some of our professional judgment in deciding what goes in and what doesn't. And let's see, I think we will come back to, there's just a couple of other questions that I think I'm going to hold, and we'll come back to them to make sure that we get through the whole form. So thank you, folks. I'm going to keep track of those and we'll come back to them.
Okay. I'm going to make this bigger again. I know in Teams meetings, sometimes it's hard to see the screen, so I want to make sure you guys can see it well. All right, so now we're going to keep moving. We're going to go down to services and supports. So we've got who's responsible, the assessment area. The way this is set up is you can choose multiple assessment areas. service name, scope of service, how often, begin date, end date. These are nice little calendar features. Choose the date. You can scroll. So it's a typical little calendar feature. You can add additional paid supports. I realized I didn't need all of that in the first one, so I'm going to go ahead and remove them. All right. Then we're going to additional supports. Same concept. You can add multiple assessment areas, who supports, what it looks like, when and how often. You can add multiple additional supports. You've got your little tooltip here. Then we've got professional referrals. Again, the assessment area that the information is coming from. You also have whether it's a new referral, when and how often. Add additional professional referrals. Now we're getting into the participation and informed consent agreement area. So if I am here and I say no to the Human Rights Committee review required field, I go on to the next area. If I understand I can change my mind at any time. This auto-populated from the beginning of the form where I put in the person that's completing the form. So the SSA, the QIDP, it automatically pulls that information down. I understand I can contact someone at, this is just a little tooltip, provider agency name. You'll need to put in the contact information and the contact person here. So now I'm going to go back and I'm going to say the Human Rights Committee review required. I'm going to say yes. When you do that, you get a new group. Everything in this gray box is tied to this yes. The date of the approval, what do I need to do to help keep myself safe, plan, if I allow this to happen. So you've got all this information that is tied to that Human Rights Committee review required field. You don't need to fill this out if this is a no, but if it's a yes, of course, then you'll have this information. We'll move on to the yes/no questions. Now we're getting into the signing. So you're going to choose the team member, name, relationship, whether they participated in the planning. Now we've got this nice little signature block. If you have a touch screen on your computer or your tablet, you can use your finger to sign your name. If you have a mouse, you can use your mouse to sign. It's kind of a little funky, but you could do it. You've got your date, have the signature. You can add multiple signatures, so you can just keep adding for as many people that need to sign off on the plan. Then we get down to the dissenting opinions, team member, name, relationship, the areas they disagree, how to address, and the date. And finally, we're getting to what's the last page. It's kind of all that contact information and the demographics. So the nice thing is the name populated from the top assessment area, so you don't have to put that in. You'll put in the address, city, state, zip, county, phone number, date of birth. Now in this testing form, you'll have to put that in. In the real form, a lot of that information is going to auto-populate for you. You'll notice a couple of these boxes are grayed out. Like I was saying, the DODD number, social, Medicaid. We don't want you to put that on this test form, but we want you to see the layout of what should be on that contact information demographics form. So it's just here as a placeholder so you can see it. You won't put anything in there. You can choose your funding source. You can choose multiple funding sources. As you add them, they're no longer on the drop-down list. As you remove them, they're back on the drop-down list. You've got your span dates, your start and your end span. Then you get into important people. Add as many lines as necessary. Now, each of these areas you want to pay attention to this additional note that the work group wanted to put in. This information should be found throughout the plan, but this section is used for contact purposes. So that way, their name, their address, their phone number, whether they're a family, friend, important clubs, organizations, and groups, same thing. This information will be in the plan, but this is just that contact information. So it's on one page, easy to get to, you can look at it and have it all at your fingertips. So important places as well. We also have the survey. So before you submit, or if you go back and work on the form later, you'll just want to make sure at some point for this assessment in ISP, you submit the survey. That's helping the team, the OSAS team, with any information in the work group to know changes, suggestions, whatever needs to be done. So now we've got the submit button. So I'm not going to submit it because I didn't make too many changes, but I want to go back up to the top here and talk about, I mentioned that you guys can view and edit your plans as you're working on them. So say you do the assessment part, you need to come back and work on it later that day or the next day. For this testing purposes, you can go back and do that. So I'm going to look, when you pull it up, if it's view, the boxes are locked, so you can't change it. But if you choose edit, it will unlock the boxes and you can add the information. You can go here for your previous submissions. So this is a really cool feature. All of the submissions that you put in with this email address are going to be here. So I can go back and I can work on this one again. So I can just click edit. And let me, unfortunately, I got to go down to submit. Now the fields are locked because I have submitted it. If I can find my mouse again, go back up here to the top. And let me look at my submissions. So new Heather 2. So put my changes in there. I can go back to the one that I was working on a little bit ago, make additional changes. You'll have this, the way you're doing that is you have this log in and log out. So there will be instructions for what you need to do, but that's all that you're going to need to do is to log in, and it will tie to your email. So I mentioned printing. So I wanted to show everybody the print feature. So again, Control P. And hopefully you guys can see the little pop-up that came up for my print features. I can see the form. I can print it. The great thing about this is, let's scroll down. Oh, and go back up a little bit. Is this the one that I added the picture? Oh, this isn't the one I added the picture. So if you upload a picture, it will appear here. The signature block's at the bottom. If they sign the form, you'll see the signature. If you've just got the placeholder because you're printing it out and you want them to sign the paper form, you have the nice little dialog box that appears there to give them the space to sign the form. So that will help you out for testing this. I think on the form itself, that kind of covers everything. So what questions, are there areas you guys would like me to go over a little more? Any issues?
So we have a few questions.
Yeah, chat.
Yeah. So one, I just want to very quick, I know we've had some folks that have maybe gotten kicked out or come in late. I just want to say one more time, this form is not the IT solution. This is a form that Heather put together for us to use to test our Word document. So I just want to say that. I don't think we can say that enough times. So some of the functionality that folks are asking about, like initiating an invite for signatures, not with this form. Again, it's just a form to make things a little bit easier. So Heather, what format will the final assessment form be? And I'm assuming Joe is talking about this form and not in a future IT solution? So is it a PDF? Is it a Word document?
It is a web form. So it's just online. You're going to view, you can edit it, you can look at your previous submissions. If you want to print it out, there's where you would do Control P and you could print it out. So you can print it out to a printer. You could save it to a PDF. But for this testing purposes, for this form, it is just a web form.
Great.
And I know there was a question about, will providers be engaging in those conversations about rule changes related to outcomes? I would assume that that will be like many other committees where providers will be represented, stakeholder groups, and I think the department's gotten better. We've gotten some really diverse work groups started to date, and I think that will continue in the rule discussions. So absolutely, provider organizations will be represented.
Thanks, Beth. Do you require the signature for testing? Kim is asking. If printed and signed, it would need to be scanned to you. No, we do not. We do not need that. Thank you for asking. What about if we don't use laptops in the meeting? Can a signature page that is signed manually be scanned? So again, this is not the actual system. It's just the form. So we do not need you to manually scan anything for this testing. So a lot of you have really great questions that I think are things that will be capabilities of our IT solution. But for this, again, the form is amazing, but it's not quite as fancy as the IT solution will be.
Yes, definitely.
So I'm just, yeah, I know we saw a couple of things. Probably what we'll do, since it's 2:58, if this is okay with everyone, is we will save this chat and make sure if we didn't get to your question, we will respond to those in our follow-up email. So maybe give us just a little bit of time to get that together. But for the sake of time, we may just go ahead and finish up if there aren't any questions specific to how to use the form. I know it was a lot. Okay. All right. So thank you so very much, Heather. Heather, as always, will be available to help us with any questions or concerns that come up as you're testing, just like she was last time.
Yes.
Okay. So let me get back to real quick. Okay, so let's see. Heather has some tips. I just wanted to call that out. She did put together an extra document with some tips for some simple things to help you with using that form that she just shared with us. So we'll be sending that to you as well. Just a quick reminder about the importance of the feedback survey. So just like last time, it's a SurveyMonkey link that, as you saw, is built into the form, but we're also going to provide it to you in a couple of other ways as well as the other team members. So we do ask that you take your time, you provide the great detail that you did last time, and also know that you can go back into a survey and edit your responses in case you're like, ooh, I forgot to add that. You can always do that. So please feel free to, or please do take time with that and ask that the other participating team members do as well. So some next steps, you already received some documents from us, so I won't go over that again, but immediately following this webinar, assuming that we don't need to respond to additional questions, you're going to get some links. You're going to get the electronic form and the tip sheet. You're going to get the link for the feedback survey. And then you're also going to get a recording of today's webinar. So I may add to that a chat with questions answered if that would be helpful. So that's what you can expect from us here in the next few hours. Were there any final questions as we wrap up related to the form, testing in general, what to expect? Check in the chat just to be sure. Okay, well, as I said, we will go through this chat and see if there's anything that we need to reach out to you all to respond with. Otherwise, thank you so much for joining us. Thank you so much, Heather, Lisa, Beth, Heidi.
You're welcome.
Really to all of you who are testing. We just appreciate you so much. And the work that you are doing is going to be tremendously helpful as we continue to progress with this assessment in ISP. So thanks to all of you. Have a great afternoon.
Thanks, everyone.
Yes, bye-bye, everybody.
Bye.
Hey, Heidi, I think you have to stop the recording. It wouldn't let me. Oh, maybe she's gone.
When everybody leaves the meeting, the recording will stop automatically if nobody remembers to shut it off.
Okay.
So hopefully nobody stays on here for an hour afterwards.
Oh, that'd be awesome. I'm trying to remember. Does this
Hold on.
automatic?
Oh, it's going to let me stop it. I'm going to go ahead and stop it for you, okay?
Thank you.